We're going to talk about a really fascinating, but also pretty scary condition today. It's a situation where your body's own security system, the very thing that's supposed to protect you, gets its wires crossed and starts attacking you. Let's dive into the world of Guillain-Barré syndrome. I mean, really think about that for a second. The one system you rely on to fight off invaders suddenly sees you as the enemy. That's not science fiction. That is the fundamental, frightening reality for someone who develops Guillain-Barré syndrome. Okay, so what is it exactly? Guillain-Barré syndrome, or GBS for short, is an autoimmune condition. In simple terms, your immune system mistakenly attacks your peripheral nerves, and those are the nerves that connect your brain and spinal cord to the rest of your body. They control your muscles, your sensations, everything. The result? A weakness that comes on shockingly fast and can even lead to total paralysis. All right, so to really get a handle on GBS, we have to start with how it first shows up. For patients, the beginning can be incredibly alarming. GBS is kind of famous in medical circles for its classic presentation, which is something called ascending paralysis. And it's pretty much what it sounds like. The weakness usually starts way down in the feet and legs, and then it literally climbs up the body. First to the trunk, then it spreads to the arms, and in the most serious cases, it can affect the face and even the muscles you need to breathe. But, just when you think you have a neat and tidy rule, medicine throws a curveball. While that climbing paralysis is the textbook case, it doesn't always happen that way. For some people, it actually does the opposite. It descends, starting in the arms or face and then moving down. That kind of variability can make getting a quick diagnosis pretty tricky. And let me tell you, it's not just about feeling weak. Not by a long shot. GBS comes with a whole collection of other really serious symptoms. A huge clinical sign is areflexia. That means your deep tendon reflexes are gone. You know when a doctor taps your knee and it kicks? Well, with this, you get nothing. Patients also get weird tingling in their hands and feet, awful back pain, and their vital signs can go haywire, blood pressure and heart rate all over the place. And the biggest, most immediate danger is respiratory failure. That's an absolute medical emergency. So, you have to be asking, why? What on earth causes your own body to launch such a devastating attack on itself? Let's dig into the cause. Now, this is a super important point. GBS isn't caused by a live infection attacking your nerves. It's the aftermath of an infection. Your body does a great job fighting off some bug, like a stomach flu or a cold. But in the process, the immune system gets confused and starts this misguided, friendly fire attack on itself. So what kind of events can trigger this? Well, the number one culprit, the one most often linked to GBS, is a bacterial infection called Campylobacter jejuni. It's a common cause of food poisoning. But it's not the only one. A bunch of viruses can do it too, like CMV or the Epstein-Barr virus that causes mono. And in very rare cases, other things that really rev up the immune system, like a major surgery or even some immunizations, have been identified as potential triggers. This brings us to the core reason why this happens. It's a fascinating concept called molecular mimicry. Think of it like a case of mistaken identity on a microscopic level. Your immune system makes antibodies to fight off that Campylobacter bacteria. The problem is, a piece of that bacteria's outer shell looks almost identical to a piece of your own nerve cells. The antibody, in its rush to do its job, can't tell the difference, so it attacks the bacteria and it attacks your nerves. Okay, so you've got this wild clinical picture with all these confusing symptoms. How do doctors actually figure this out? Let's look at how they solve this medical puzzle. Well, doctors have two main tools in their diagnostic toolkit. First, they'll do nerve conduction studies. This is basically like an electrician checking the wiring. They measure how fast electrical signals travel through your nerves. In the most common type of GBS, the nerve's insulation is damaged, so those signals slow way down. Second is a lumbar puncture, or spinal tap. They take a small sample of the fluid surrounding your spinal cord, and they look for a very specific telltale sign, a really high level of protein, but a totally normal number of white blood cells. This classic finding is the smoking gun for GBS. And these tests also help show that GBS isn't just one single disease. There are different flavors. The most common one, AIDP, is where the attack is on the myelin sheath, that nerve insulation we just talked about. But in other forms, the immune system goes after the nerve fiber itself, the axon. There's even a rare version called Miller-Fisher syndrome that shows up with a very unique trio of symptoms involving balance, reflexes, and eye movements. So, the diagnosis is confirmed. Now the clock is ticking. It's a race to stop the immune system's attack and get the patient through this crisis. When it comes to treatment, there are two main options, and all the research shows they work equally well. The first is called plasmapheresis. You can think of it like a blood cleaning. A machine filters the patient's blood, specifically pulling out those bad antibodies that are causing all the damage. The other option is intravenous immunoglobulin, or IVIG. This is where they give the patient a massive infusion of donated antibodies from healthy people, which basically helps to distract and neutralize the patient's own haywire immune response. Now, here's something that might really surprise you. When you think of an out-of-control immune or inflammatory response, the first drug that probably comes to your mind is steroids, right? Well, in this case, no. It's a critical point. Multiple big studies have shown that steroids just don't work for GBS. They provide zero benefit, so they are not used. And beyond those big treatments, you have what might be the most important part of all, supportive care. And this is everything. It means someone is watching the patient's breathing and heart rate around the clock. It means managing pain. It means getting physical therapy started right away to keep the muscles from wasting away. This supportive care is the bridge that gets a person from the absolute worst of the illness to the beginning of their recovery. Okay, the acute phase is absolutely terrifying. There's no doubt about it. But what comes next? What does that long road back to health actually look like? So here's a typical timeline. The weakness gets progressively worse for about 2 weeks, and then it hits a plateau. It just sort of stays at its worst for a bit. Then, usually about a month after it all started, the recovery begins. And this isn't like flipping a switch. It's a slow, gradual process of nerves healing and repairing that insulation, and it often takes months or even years of really hard work and rehabilitation. And this, right here, is the most important thing to remember. As absolutely life-shattering as GBS is, the outlook is generally positive. The journey is long, it's difficult, but the human body's ability to heal is just incredible. With the right treatment and that all-important supportive care, the vast majority of people make a significant recovery, and many recover completely. The story of Guillain-Barré is just a powerful reminder of how incredibly complex our own bodies are, and how they can sometimes make mistakes. It really leaves you with a big question to think about. How many other diseases out there are just another case of friendly fire from our own confused immune system?